Welcome to Megaphone from Medvale Media. I'm Dave Self. This is the place where we ask healthcare leaders to share their thoughts, their perspectives, and the occasional rant about the state of healthcare today. Really excited today because it's a very non-traditional sort of Megaphone episode. And it's because my friend and colleague and fellow Medvalista will tell you what that means in a few minutes if you're not already one. Tom Ferkovic is joining us today. And I'm so excited, Tom, because we're going to pick apart healthcare, come up with some solutions, probably solve the whole thing in 20 or 30 minutes. And then the federal administration doesn't have anything left to do.
Perfect. No, then we can go and watch the playoffs on Saturday and Sunday. We're all good.
Exactly. We'll get this thing done and dusted in no time at all. Tom, truly welcome. Thanks for joining us today. Really, really excited about the opportunity. But before we dig into solving healthcare, could you share some about your background and why you're a part of Medvale today?
Sure. Thanks, Dave. Appreciate it. Appreciate everybody who's going to take the time and kind of listen to me. And those of you that know me probably already wonder what the color of the sky is in the world I live in. And those that don't are going to go, what color is the sky in this guy's world? So it may be a little bit of my background. So I'm actually a pharmacist by training who lost his way through promotions at a hospital called St. Luke's Hospital in Cleveland, Ohio, which was a terrific place to learn because we had unbelievable physician talent, research, training programs, but no money. So we got to do everything. So if you were being promoted, you had to touch every part of healthcare. And that's kind of where I am and why am what I am today. From there, I actually went into managed care in the 90s. Believe it or not, I'm from the 1900s. This is scary. So, so from being from the 1900s,
Hey,
you
easy
know,
on that age thing, pal.
oh, but being back then, there was the first time we went into healthcare reform, and I think we're in about the third or fourth, was Hillary Care. And I was part of that. Again, being able to learn, take capitation, work with physicians, and go through that with a company who was private equity backed. So way back then, there were people pouring money into healthcare under the FICOR days and the Med Partner days. I got to learn how to work with doctors from there. And how I got into learning and working with doctors, because that's been my career, is back in my St. Luke's days when Hillary Care started, doctors started to look for employment because they couldn't figure out how to do this business end. And apparently, being one of the vice presidents who did not look down fast enough when the president of the hospital said, "Hey, we got to employ some docs. We need somebody to do it." And everybody else backed away but me. And I got into the business of physicians' practices and the business of medicine. And that was a wonderful area. And then from there, I started my own company called Medic Management Group, which I just retired from, and I'm chairman emeritus after 25 years of having a national, what we'd call today MSO. But we did that. And the only other thing I will tell you, so you understand where my head comes from, is I started a business not to sell it. I started a business to fulfill the mission, which was to help doctors and other healthcare hospitals who employ doctors to be successful so they could do what they do best. So we wanted them to be successful. I didn't start a business to flip it. And when I sold it to my succession plan, I did it with that goal and we continued there. So my strange color of the sky in my world, you need to understand my biases.
That's a pretty nice color of blue, though. I can see it from here. Uh, first of all, congratulations on retiring and the emeritus status. That speaks volumes as to how your succession team views your participation. Also, when you mentioned your days at St. Luke's doing so much with really no money, it harkens back to something a friend of mine said a long time ago. We've done so much with so little for so long. We now feel as though we can do absolutely anything with absolutely nothing. And it sounds like that may have been the path you were on.
That's true. Absolutely right. Absolutely right.
So let's introduce Medvale a little bit. You know, Medvale Media is the platform that brings us Megaphone. It's the place where our guests get to come on and be interviewed. But Medvale is much more than a media platform. And it is a community of people, of healthcare leaders from across the country, all executive level of varying stripes. some business owners, some people involved in hospitals and health systems, independent physicians, physicians that have been in the business a very long time. It's just such an amazing tapestry of talent, Tom. I am still amazed that I have a privilege to be part of it. So why don't you give us your take on Medvale itself and the role Medvale can play as we start contemplating true transformation in healthcare?
Oh, I think that you're right, Dave. This is every day I meet someone, new person in Medvale, and I just go, "Wow, how did I get to be part of this?" And help other people within it. So even though we have our own mission and we have the thing written, my interpretation of Medvale is we're doing why we all joined healthcare was to help others. So we're helping the top talent in healthcare as peer support, whether it's new concepts, whether it's learning things, whether it's pushing whatever they're working on forward, whether it's being there just for someone to say, I got a vent and get out of, help someone. That's my simplest way of describing it. There's so many more awesome things that we can grow. But as Jim and I talked many a time, the way to measure this is if we help one of our Medvalistas do something, they're going to touch, whether it's a physician in with a practice who has 5,000 patients or 10,000 patients, or a health system that's treating 100 or 200 or half a million patients. If we've improved it, we've touched that many people, and that's what
That's
we're
well
really trying to do.
that's well said. I wish I would have stated that myself. That's a great why behind the what for Medvale for so many of us involved. By the way, you mentioned Jim, and for those of you that are not Medvalistas, and yes, we actually use that term to refer to ourselves. Sounds a little like Sandinista, which makes me uncomfortable, but we're going to roll with it anyway. When we say Jim, it is Jim Tronson, who's the founder and the mayor of this town called Medvale, and big visionary, and really brought us all together to do the things that Tom just articulated so well. You know, Tom, we've been talking lately, and in fact, I also want to rat you out. You lead the town council. I'm privileged to sit on that august group. Again, I look around and say, "What the heck am I doing here?" But in that forum, we've been discussing the real challenges of healthcare today. We have access and affordability. And you know, if you can't afford it, you can't access it either. So I think those two things are really intertwined together very closely. There is quality, of course, which is a theme that you find throughout healthcare. I've never met a physician or care provider that wanted to give anything less than high quality care, but it is something that we need to pay attention to. Um, there is physician burnout. There is the dynamic of a pandemic that we're just coming out of that really did change the way some care is not only provided, but how we interact with one another, even in forms like the one we're on today. And then we get to things like the assassination on the streets of Manhattan of the CEO of the largest payer in the country. We get to the reaction by many supporting the assassin. Um, it's troubling to say the least, but as we've talked, doesn't that begin to give us an indication of something below the surface that maybe we haven't paid close enough attention to, a real concern on the part of everyday people about whether or not they can afford and access the care that they need?
Dave, I agree. We all of us that have been in healthcare or are looking at this, all agree healthcare's a mess. But then we got to break it down, like why. And I think the first thing is we have to say is trust. Healthcare has always been a trusting profession. We go to our doc. If my doc says go to this surgeon or go to this hospital, I go.
Right.
I may read about it. I may now Google because I can do it, but I trust. And if you can always survey, being a pharmacist by training, I was always proud of, pharmacists were always the number two trusted profession. Well, if you kind of go to the last surveys, well, yeah, doctors, God bless, are still the number one. Pharmacists are two or three. Nurses, okay, that's all great.
Right.
But if you dig deeper, from 2019 to 2023, yeah, we're still up there, but the ratings have come down. So where we might have had been 60 or 80% trust, now they're 52 or 54 in the different categories. So yeah, we're still up there, and I don't know what that says about the rest of the professions, okay, because they're falling too. But trust is it. And we have to remember where we are. And the trust then, if you take that as the high bar that we have to cross,
Right.
then you can break down all of those things that's kind of crumbling in our foundation, right? If that's the foundation, I guess, and now we have leakage in the basement because of it, we've got to figure out where that is and how to do it and quit talking about it and actually do some actionable items. And I think that's what we're talking about with Medvale as well.
Again, well said. So share Tom's vision of healthcare. What's the structure of healthcare look like? Where do we start addressing things? Let's pick that apart a little together.
So let me start by giving you my bias because I had a great teacher when I was at St. Luke's Hospital, the chairman of the Department of Medicine, who supposedly reported to me, but I knew that didn't happen because I worked for him, taught me, and this is kind of forget your political bias, but James Carville coined many years ago, it's about the economy, stupid. Well, in healthcare, it's about the doctors, stupid. If you don't know that's where it starts, then let's not even have this conversation. So the sky in my world starts with the doctors and everything flows from there. But if you believe in that, then I kind of break it down again in my strange way into four areas. Okay, if we're going to really look at healthcare and all this noise about how we're going to change it and do things, I break down four things. One I call concrete. We can get into depth on this and get your opinions on it. But that's the buildings, the concrete. So if we're going to change medicine and be more outpatient, then why are we building concrete? We can't feed those concrete animals. It's hard to
Right.
change if you got to feed the animal, right? Two is flow. And under that, I consider doctors, procedures, access, rural health, money, the healthcare deserts we have, all of those. That's what I call flow. The third one I call is, high hurdles or, the high jump bar that we have to go through. And to me, that's red tape. That's things like the idiots that ever decided that the only way we can prove that someone does something is if you sign a form. So, i.e., let's just think HIPAA and BAA. So, if I sign a BAA form and now I have more freaking paper out there that I got to pay for and follow, that just means I won't violate it. Well, you're an idiot and you shouldn't be in healthcare. Okay. But there's so many more. I'll give you an example is I just had a hospital thing in the fall and I never realized this. And I'm in this profession. I got a certified letter from Medicare who somebody a hospital had to pay to tell me that I had the right. Now, this was a week after my discharge, the right to appeal that I was discharged. Hey, idiots, I'm home and someone had to pay a certified letter to bring to me. Are you kidding me? I mean, those are the kind of hurdles and red tape that we have to acknowledge before we do anything. In there I have also the insurance model, insurers, and then the whole brokers. They're making more than all of the doctors and everybody else is making in this deal. And I'm not just talking about the insurance industry, the whole model, and then pharmacy
Sure.
benefits in that. And then lastly, I consider pillars. Pillars are doctors, other providers who care, who do this because they really care. I mean, some of the stuff that the nurses do, or the people who work in hospice. God bless them. I mean, how do you how do you describe that, right? Health systems that doing the right thing. And lastly, let's all admit that patients have some responsibility, right, in all of this. That if I am a diabetic and I just will not stop eating cake, there's not a whole lot we in the health system can do for that. Okay. At some point, there is some personal responsibility in this. So, my view is we got to tear these things down, and they all have 1,000 components, but healthcare is different. It is labor intensive, and I don't care what we do, you're still going to be a high touch industry.
Yes,
You're not
absolutely.
gonna have,
AI is not going to
yep.
knock out the people
y-
factor, and
Yep.
it shouldn't.
No, and I mean, my computer is not going to take out my appendix. Okay. We may get better at some things, but it's just not going to happen. It's local, right? And if you're in healthcare, it's not about the money. And, now we all do very well. I did very well, but it's not about the money. It's not why we're in it. So those are my biases to go in. If you want to break it down, if you want to say, hey, it's been a great afternoon, we can stop right there. So
Well, Tom, it's been a great afternoon.
I
Um,
agree with you.
now, so concrete flow, the high hurdle or the high bar, and the pillars. And so, yeah, let's dig into that just a little bit. The concrete, I think that's one thing that we might come back to at a high level. We both have biases about these things. I agree with you. Why are we building more buildings? When on one hand we're saying outpatient, health at home or hospital at home, what can we do to keep people healthier? And yet we keep constructing things. Now, some of that is out of need necessity in a particular community. If the growth
Mm,
happens to outpace capacity,
yep,
if it particularly as where I live, the inflow of new people, which has been significant, largely people that are 55 plus.
agreed.
So
No, agreed.
capacity of the healthcare
Right. That's
community
different.
in each community is going to have to be representative of the need, certainly. But, chucking a bunch of money at more brick makes no sense if we're really trying to transform the model. But we default to that quite often.
No, I agree with you, and we can explore that again another time we have time because all of these that's the other problem with healthcare, right? It's not simple, and it is local,
That's right.
and we've got to look at all those things. So from that standpoint,
I don't know how you view it, Tom, but I do see when we pick on things like the high bars, you start talking about um, the paper involved still. I mean, there's fax machines for Pete's sake out there. People are using fax
yeah,
machines, and you
yeah,
can't get to some of them without a freaking fax machine.
yep,
It's mind blowing, but I do think that we suffer in this industry from good people, smart people coming up with a solution at some point in time. In the 90s, during Hillary Care, somebody came up with an idea and it was put in place. And the next year, somebody had an improvement and they put that in place. And we keep layering things on. We never take stuff off the bottom, or we
right,
rarely do, until you get a real market disruptor, someone that
right,
comes along or some entity that comes along and says, hey, listen, there's a much better way to do this. Now, technology has had a role in that, certainly, but it hasn't disintermediated the real core of how messed up all the administrivia is.
yep, yeah.
What would be the best starting point from your perspective?
Well, so let me ask because you bring something up that's driven me crazy for a number of years, and all our Medvale friends who are consultants will they're about to shatter. Their heads are about to explode when I say this. Okay, so many years ago, when $5 billion was a lot, all the consultants in the world said for healthcare systems or any healthcare entity to be successful, you had to be 5 billion in size.
Right.
And I always asked why, and no one could say other than they needed to be 5 billion in size. And now I don't know what that number is, what they would say because 5 billion is not a whole lot anymore. But I'm not sure that is, and it's that 5 billion in size entity that may not allow us to blow up the system and start over. General Motors is not blowing up General Motors because somebody's got a flying motorcycle, right? Or as our friend Lars, has a hydrogen car, right?
Right. Right.
You got to start something totally different. But if we've determined that market shares are these $5 billion or whatever they are today entities, that that is one of our issues. And that kind of, I would say, falls under my concrete component, right? Look at GE. For GE to blow itself up was a big deal, right?
Yes.
They had to do it. It's hard to blow up those things and start up. It's the young startups, it's the new areas that change, that are the disruptors and change the world, or those that spin something off and let them do that. And maybe that's one of the kind of under my concrete rule. Maybe that's part of it.
If we stick with the administrative load that we've placed on the industry itself, the people that access care, the people that provide care, the people that adjudicate the claim, the federal government, the state government. There are more layers in this thing you can than you can imagine. And as you point out, when you personally accessed care, you found some things that you were not prepared to to understand. And I think we've all probably had that experience at some level, whether it's in a clinic environment, being asked for your information 5, 6, 7 different times, or whether it's the kind of bills people get, the explanations of benefits, the explanation of payment to the provider. These layers just don't bring value.
No.
Is there a path forward that you see where we can stop the madness and say, if we had a clean sheet of paper, what would we build? It sure as heck wouldn't be what we have.
You know what I would love as my crazy view of it is, so do you guys all remember when Apple they opened their code for apps?
Yes.
We said that our Medvalistas are really smart and we're impressed and we're blown away. Now imagine all of the people, if we opened the code up and let these smart people attack and develop their apps, quote unquote, for healthcare. That would be, but we protect the code, right? Let's think about where we protect the code. We protect the code under insurance companies because you can't figure out how that stuff's done, right?
Definitely.
Unless you're self-insured, we can get into all that. We can peel back the layers, but let's just start at the high level and have people somebody else smarter than me do that. Let's talk about Epic. Try and break the code and get into Epic. You can't. It's
No,
not possible. Okay.
no, it
It,
is ironclad.
yeah, it's their way or the highway. Again, good or bad or indifferent, but you can't break the code. That's what we've done. The mega health systems, you can't break the code. Okay. So let's open it and let's be like Apple and give the smart people the code. And then let's take all of these areas wherever they're the best in and let's attack it and let the smart people run with it. And we know a number of Medvalistas who are doing some really cool things that are going to change the world. And I think that's pretty cool. But that's where I would start is we have to break the code. But the code right now has so many walls around it, whether it's rules by Medicare, whether it's rules by insurers, whether it's legal rules, whether it's state rules, CON versus non-CON. Yeah, let's open up the code. Let's fight to get the code open so that the smart people can go, I can do that better. That's cool. That's my high level.
Oh, is that all? Well, I think we are done. We're only 20
Yeah,
minutes in. I
yeah.
think we've solved it. Thanks, Tom.
Yeah.
No, not being snarky about it, but I think it's hard to disagree with what you said. There is so much attached to the current state that opening the code would be a disruptor to the economy, certainly in meaningful ways. There are a lot of jobs attached to all the hassle that we go through in healthcare. There are people behind every one of those processes is a person usually, or somebody writing code for a system that adjudicates it, right?
Mm.
Um, Getting over that high bar in your four examples of things we need to address, how the world breaks out in your twisted mind. The I think that the economic impact would be untenable, not just to the industry, but maybe to society. I mean,
Yeah,
if we really broke it,
I wouldn't, to me, I don't think so. And here's where I would say our jobs in healthcare, all of our jobs, my job was never in any of the ones I had was to maintain jobs. It was to fulfill the mission of the organization. So way back, the greatest learning I ever had was as all hospitals were having problems. So I'm back in St. Luke's. We get a new president walk in on the first day of January, way back when. And we know we're in trouble because Kaiser just pulled 30% of our volume and went to another hospital. I mean, 30% of our volume, we're like, oh my God. And he comes in and he says, what's our mission? And we all kind of looked at each other and said, oh, we better look it up. And the mission said, provide health care in these zip codes. It didn't say have a hospital in those zip codes. And he stood up, a new guy who moved his family, stood up and had the guts to say, doesn't say hospital. That's what it's about. So what is our mission in each of our different roles? Is it to preserve jobs? Is it to make my health system greater? Or is it to provide quote unquote healthcare to a certain zip code? And if you unpack and fulfill that mission and fully and unafraid to do what you need to do, we'll go through it. Dave, so it's funny. Years ago, I would sit there. I would give these meetings of C-suite guys, presidents of hospitals, and it was,
Sure.
we were going into value based. We're going into managed care, into capitated and stuff like that. So I would ask the room full of CEOs. I would all ask them, guys, can you raise your hand, ladies and gentlemen? Just tell me how many of you will go to your board tomorrow and say, listen, you guys, here's what my vision is. I'm going to change how we do healthcare. Now understand, for the next couple of years, we're going to lose a lot of money, but we're going to change it because we're going to change from what we're doing to value-based or
Right.
preventative or chronic. How many of you will raise your hand and say you're going to go do that? And then I'd have to say, oh, sorry, let me repeat it. Maybe you didn't hear my question because nobody raised their hand, right? And finally, after the third time I say it, one guy would raise his hand. He goes, I could do it. But he goes, I just want you to know, I just announced I'm retiring in a year. That is the courage, if you want to change healthcare, that it takes in each, and there's a billion steps to it that it will take to do something different. It is easy to continue to do what we're doing and bitch about it, and to hire security guards for presidents of health systems and healthcare organizations and stuff. And by the way, I don't think that's part of the mission. I don't know how Medicare funds that. Okay. But
Yeah,
again,
there's
you
not
can,
there's not a code for that.
no,
Um,
at this point you go, what color is this guy in this guy's world? So
no, you're helping us see it. And that's helpful. Um, let's jump to the government for just a moment. And set aside the personalities involved for a minute, but keep the concept of new thinking, disruption, and as scary as it might be for some of the people involved that they're promoting, is there an opportunity now to really maybe start digging into what you're getting at with some new voices, um, disruptors, some new thinking, not tied to the status quo, certainly. I think we could safely say that with the names that have been floated for a number of the key roles. So is this a time where maybe it's a productive inflection point that we could take advantage of? Because if it is, we certainly could look around our little community of Medvale and find people that could contribute to that.
depends, right? Great answer. Great weak answer, Tom. It depends on which camp you're in. And what I mean by that is, so I have this strange philosophy that believes, okay, that in business, when are the only times we complain about healthcare? When the economy takes a downturn and the accountants all come back to our budgets and start circling the big numbers, you know, our rents, our buildings, our people, benefits, and you circle those and you go, but if the economy is in one of these, right, then nobody cares. We're buying buildings, we're building stuff, we're trying to hire employees. We could care less what that number is. Okay. I mean, you don't like it when the renewals come in. Okay. But
Sure.
if you're cranking, if you're growing at 15, 20%, you got to put that to the side. We'll deal with it when we need to. So right now, if you believe that the economy is going to do this, then healthcare is not going to be on anybody's radar. I actually think that's a good thing because I think you can make changes. Okay? If you think the economy is going to do this, you're going to hear the complaining. Okay. And that's a bad thing right now because I believe both sides of the aisle could care less because it's a safe thing the people will want us to fix it. Unfortunately, if the government fixes it, I'm not sure we will get to that disruption that you and I talked about to truly change it. They're just going to tweak it at the edges. They're going to cut what they get paid, which we already did, right? They're cutting that this year. And they're going to put more rules on us, and they're going to make us even more bureaucratic, and that's not going to change it. So I'm kind of hoping the economy does this, and all of our cool people have an opportunity to do something different, under the radar, and not waiting for Washington to do it.
So what I'm hearing you say is, if someone from Washington shows up and says, "I'm here to help, I'm with the government," we should probably not open the door.
Yeah, what did Ronald Reagan say? Those are I forget how many words, the scariest 10 words there are. I'm from the government and I'm here to help.
Here to help, right?
Yeah.
So if we're, I want to push back for a minute on something before we move on. So with the economy, let's say the economy does rise, it's going up and to the right, everybody's happy, most everybody's happy. Business leaders are okay with rising costs to a point. I'm going to push back and say I don't think that the major employers are anymore. And the evidence, from my perspective, is that the rise of things like ICRA, to give an option to an employer to say, we're going to blow up this plan. Well, I realize we have 5,000 employees. We're going to blow this plan up, ERISA
Yep.
aside, and we're going to give you X money. And through this ICRA plan, you go get your own coverage. And it's better for you because you get to personalize it. If you're 25, you're going to buy one thing. If you're 55, you'll buy another. If you have a family, you're going to take care of that. So kind of work your way through that. I think that the major employer, regardless of whether the economy is going up and to the right, is had enough. I think that some of the coalitions that are being formed are informing us to say we've hit the stop point. It's not okay to have the escalation of cost for a family reaching $24,000-$25,000 a year in premiums, or
Well,
cost if
yeah.
it's a self-funded plan, of course. But so I think that we may be at a point where the major employers could, if they choose to, lead the way to some sense of reform. How does that square with your thinking?
Well, so two things you said. So I, 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 I don't disagree, but I'm wondering if they've hit the stop point because of the noise on inflation. Okay. And their other employee costs. But so I agree with you. They've hit a stop point. The problem they've got is I can tell you that now that I'm a Medicare recipient, my Medicare premiums are more than I was paying on my now. Again, that's income based. I get it.
Right.
But it also goes downhill. So, right. So it's actually, I'm paying more, okay, than when I paid when I had my commercial for my company. So if Medicare is already up in that range, okay, on it, then that whole pushback, there's two sides to it, right? That we got to push back on. Um, it's complicated. I still think though, if the pressure is to hire great employees and give them what they want to get them, I still think you're going to see that. But that's just, again, yeah, that's just me. I've always oversimplified the concept. But I really, the most of the noise is when we're hearing problems on some other component. I don't know if I forget who's printing. Nvidia is printing money right now. I don't know that they're really caring about their health insurance benefits.
No, I would agree for in NVIDIA's
Yeah.
case, but there's a whole lot of major employers around the country that for the last probably decade have been increasingly disenchanted with what they receive, and the cost continues to go up. So it's
Oh, there,
whether
no
we
doubt, no doubt.
whether we've
How
reached
about
the
the
break point
mid-level?
remains to be seen.
Yeah, it's the mid-level ones,
Yeah.
and they have no choices. And those are the ones that are getting 25, 30. And I just heard of one, that got a 50% increase this year. Those are the ones, and then that goes into the cool programming, chronic care. What can we do for those people and
Right.
get them into, like you say, coalitions? But again, those are rules, right? We've got all these rules. Why can't they bundle themselves? Well, we have these rules that we all have to play in. And it's a shame.
It is. It strikes me too that with I want to make sure I remember them all. There's concrete flow, high hurdles, high bar, and the pillars. There doesn't seem to be a place where smart, respectful discussion, honest discussion, you can pound the table a little bit as long as you're respectful. It doesn't seem to be a place where that takes place anymore. The conversation seems to have gone away along with common sense. So common sense just isn't so common apparently. Um, it does feel, and this is not a Medvale commercial by any stretch, but to highlight one of the things that we hope to achieve in the Medvale community is to be the place where people can have the conversation. We've got wicked smart people in the community, and we've got neighbors that are wicked smart too. They may not be Medvaleistas, but there's always a place at the picnic table for you if you want to come over. Is there a place still for that kind of conversation to dig into what you and I are digging into?
I don't believe there is one external to Medvale. I believe there should be one in Medvale, and that's kind of my let's open the code. If you have an idea because you saw the code and you want a place to bounce it off of a bunch of smart people with a lot of different backgrounds that could say to you, hey, that's a great idea, and say to you, say it back to you and give you feedback on your idea in a safe place with honest, responses and not having to go before a governmental agency or someone like that or
Right.
test it, then yeah, I think we could be that place. And I think we should be. That's our peer support, our and even possibly now we should make it neighborly support, for our little town. But I don't know of another place you can go to do that that doesn't have strings.
Yeah, there's a lot of screaming going on, and the noise level continues to escalate. I do want to touch on the public reaction to the killing of the CEO of United Healthcare on the streets of Manhattan, and it's troubling. And a number of us have had these conversations amongst ourselves, but I've had the conversation with my colleagues too in my day job, and it's troubling to the point where people are looking around saying, "What have we missed?" Um, one thesis is we've been so busy creating this beast that we've not listened to the people that we purport to care for. Um, and if that is the case, we've got some splaining to do, Lucy. And that's something that I think is it's got to be a conversation.
Yeah, Dave, I think you're right. It goes back to, if you think about it, so what is it? Yeah, is it leadership? Well, maybe. Is it the system? Well, maybe. But at the end of the day, it goes back to trust, right? When we
True.
used to trust our insurers or trust our, that our, when we go to the pharmacy, we don't hear, an ad that says something was cheaper because we just didn't have the right card or whatever it might be and have to do this. And we trusted our HR people because they had the right broker and they picked the right thing for us as opposed to whatever it was. Or, we could trust our hospital or whatever it might be.
Right.
We need to get back and start to figure out the ways. And there are, many, many more smart people. And yeah, I think maybe our challenge out there should be the way you fix it is not by having bodyguards and CEOs. It's an unfortunate evil we have to deal with today. The first question is we have to go trust. How do we rebuild that? And every organization has to build that trust with their employees, with their constituents, right? And into their boards and into their missions. And there's many facets to that beyond what we can talk about. Um, but until we have that trust back, we're all going to be looking over our shoulders. And that's not a way, that may be a way to run some other companies, but not a way to run something in healthcare.
We haven't talked much about the pillars. Well, you did touch on how important the people who actually provide care are to this equation. You don't get to do anything without the physicians, the nurses, the other care providers that are at the bedside, at the clinic, on the phone, taking care of the people that they've committed their life to. Um, Comments on how do we care for the caregivers? What are your thoughts?
Yeah, the burnout is amazing, and it's not just physicians or nurses. So for every physician, there are four people. The physician gets busier. Well, those four MAs or those four front desks, they go crazy too because they've just had their numbers multiply, and we have to remember that. And the other problem with it is the patients are burned out. When you got to wait 2 months to get into an appointment, or I just heard today, try and get a psych appointment or behavioral health appointment.
No,
I mean,
in most communities, that's good luck. The
yeah,
mental health provider community may be the thinnest piece of the fabric that we have.
yeah. And you think about that. So the burnout is across the whole piece with healthcare. And so we can't just look at one segment. We have to treat it all and go through it and figure this out. But doing it in the traditional way that we're doing it today is not the way to do it. I mean, to continue the model is not the right way to do it. That's not an answer because it's a high level. I mean, it goes all the way down. But I can think of, when people were saying, "Oh, close OB in these smaller hospitals in the rural communities. They can drive 30 minutes." Well, that husband ain't going to be too happy when he gets to that ER 30 minutes away, right? Because he's scared to death for his new baby or his wife or whatever it might be. So you want to talk about burnout? They don't really care about the burnout on the other side of the desk, and I don't blame them. So we've got it. It's a multi-layer thing, and that's why I'd love to open the code and say, "Hey, smart people, we got to figure this out," and it can be done. We cannot do it the way we've been doing it. I've been through 3 or 4 healthcare reform models, and we keep going back to the same thing we're doing. It's time.
No, no, it's a true story. And on this podcast with other guests, we've talked about what is this value-based care concept that we're talking about today. If you go back to the HMOs, and you mentioned Hillary Care, well, that forced the hand of a lot of leaders to say, well, I guess we better have HMOs. But HMOs were really driven not by the people providing the care, but by the insurance companies. And I was on that side of the equation then. And we came to the physicians and the hospitals and said, okay, here's the deal. We're going to tell you what to do, and here's how much you're going to get. And you have to ask us for permission to do some of these things too. How does that sound? And amazingly, the HMO concept never really, the sales never really got filled with wind.
No.
Uh,
Mhm.
so then we fast forward a little bit and we go to point of service plans because it's kind of HMO-ish, but it's not really. So, hey, you ought to sign on for this. And that didn't work really well. You fast forward again, and then you get into the craziness of technology growth and IPOs of the late 90s and the early aughts, and everything seemed to be okay for a while. And the PPOs came back. And then it was, well, let's talk about population health. Well, now it's called value based. And I got to tell you, Tom, when I look at those four big concepts, they're not that different.
The names have changed to protect the innocent.
Well, formerly innocent, yes, yes, indeed. Yeah, it just seems like it's a rinse and repeat. And so maybe your point about opening the code is maybe that's the next step.
Yeah, I think it is. I mean, we've got to your point when we started. Our Medvale friends and those of who want to become Medvaleistas or our neighbors, there's some really freaking smart people out there. Um, and we could be the place, the forum, to say, hey, come tell us what you think, what your idea is. Don't whine about it. If you got something to say and an idea, a lot of people here who can help you with it. Let's go with that and see if we can make something happen. But it is one patient, one patient at a time, one caregiver at a time, one system, one local, that does it. because it's about taking care of that one person.
Right on. Well, Tom, we always give our guests the last word. And even though you and I just had a great back and forth conversation, a little different from most of our megaphone episodes, want to give you the last word. But before I do, the next time I come visit Cleveland, and this is an ongoing thing, so I'm taking notes. Every guest has to tell me their favorite place to go for the local treat, whatever it is. So Ken Siegel gave me the best Philly steak place.
So there is a place called Swenson's for burgers. LeBron loves it. So it's
Well,
actually
if
kind of
LeBron
Akron,
loves it, I
Cleveland.
mean,
Yeah, it's
there
kind of
you
an
go.
Akron, Cleveland kind of thing. So you
Okay.
absolutely got to go there. So, yep,
Right on. Okay, so I've taken down the notes. So when I come back and visit you, you
yep,
and I are going, right?
absolutely, absolutely.
All right. So
Love to have you.
what final word will you leave us with today?
Can't wait to get some feedback on what color the sky in my world is from everybody who hears this.
I'm going between a nice teal and maybe a little trending towards azure. That's my take on it. But Tom, thank you so very much for making time today. It's been such a privilege. Join us next time on Megaphone from Medvale Media. I'm Dave Self. Be well.